Hello and welcome back. Welcome if you're new here. If you don't know me, my name's Georgie. I talk on my channel about chronic illness, disability, rare disease and related topics, and I'm also a student at Cambridge Uni studying biological anthropology. Okay, let's talk about this for a second, shall we? My hair is very red. I went to the hairdressers yesterday and to be fair, I did ask them to make me the most red mermaid possible. I didn't quite predict it was going to come out this bright, but here we are. So that's the thing. Also, I've been away for a while and I want to thank everybody for being patient with me and also welcome our new subscribers. It's so impressive to me that people have been finding my videos even when I've been on a very long extended break. But it's such a pleasure to have all of you here, and I'm really hoping I can make some more content for you over the next few months. I have a very busy schedule. I'm trying to get my degree at Cambridge, trying to manage my chronic illness, so I'm never going to be one of those YouTubers that can upload weekly, but I just really hope that I can use this channel to make educational content provided in a concise manner. I'm such a nerd. I love reading those medical journals, all the scientific papers, and I can condense them down for you so you can understand these very complicated topics of health that you might be struggling with, or somebody you know might be, or you might just be curious to learn about them. So on that note, a quick disclaimer. I am not a medical professional. This video is not intended to diagnose nor treat. Simply put, what I do is I take all of the latest research, I draw on my own personal experience, and I make easy to understand videos to help empower patients to take care of their health and to digest really complex information that often isn't given to you in a 5-minute doctor's appointment. So I really hope that you enjoy this video. It's going to be the first in a series I have promised for a very long time, but I'm finally getting around to filming for you, and it's going to be all about Mast Cell Activation Syndrome. If you enjoyed this video, I do have to tell you, because I work on YouTube with the YouTube overlords, that please give it a like, please subscribe, please leave a warm comment if you are able to do so. It really does help the channel, especially being such a small channel where I can't post regularly, and it means that the content can help to reach other people that would really benefit from this kind of information. So please do that if you can, and as I'm making this series at the moment, feel free to also let me know if there are any mast cell related topics you would particularly like me to cover. I will admit I've got quite a list already, but I'm still open to ideas and it would be a pleasure to cover those topics for you. Additionally, I will be covering a wider range of rare disease topics. So I've spoken a lot on my channel about EDS, for example, or POTS, but if you have other conditions that you would like me to cover, I would absolutely love to do that. Just let me know in the comments below. So let's get into today's video. And this is going to be about the top 5 mast cell triggers that often cause people to have reactions. But I have to tell you something. The idea of having universal triggers that will affect everybody in the same way is actually a fallacy. There are no universal set of triggers that affect people. So whilst today is sort of going to be the top 5 mast cell triggers, I'm not going to be listing particular foods, environmental agents. I'm rather going to be giving you some advice about 5 ways that you can help to get in touch with your own triggers and manage them. So if you clicked on this video, you probably have mast cell activation syndrome or related diseases, but if you don't and you're just here and getting the information, I've got a really comprehensive video all about the condition that you can watch that I will link up here. But a brief summary is mast cell activation syndrome is a condition that affects the immune system, and it causes reactions which are allergic type reactions to food, environmental triggers, pharmaceuticals, really anything you interact with in your environment. It can be extremely difficult to manage, and there isn't that much information out there to help you understand it. So often I see patients asking questions like, has anybody tried this product? Did you react to it? Was it safe for you? What kind of diet should I be following? What kind of diet do you follow? What are the typical triggers of Mast Cell Activation Syndrome? But the truth is that every patient is very different when it comes to Mast Cell Activation Syndrome. And your triggers can even change and warp over the course of your lifetime, which could make it really complicated to understand, and using other people's ideas about what their triggers are or what lifestyle or diet changes they follow is sometimes not so useful. And this makes the condition so difficult to manage because really your only options are to try and construct a kind of food diary to follow your triggers, to follow an elimination diet, or just to continually experiment. And that means that there's just not much guidance on how to go about this. So I'm hoping that I can help you today. So what are my top 5 tips? Well, number 1 is be aware that although every patient is very different, there are some generalized food groups or substances that evidence-based medicine has shown have a slightly elevated risk of causing reactions in patients. So these are foods like tomatoes, MSG, pineapples, for example. And I'll leave some links in the description below which shows you this research if you want to dive into it in more detail. But how do you interpret this? Well, it doesn't mean that you're necessarily going to react to these things. You need to make sure that you're not cutting things out, for example foods, if you know that you've been regularly consuming them and they're actually not providing you with much trouble. However, this can be really useful to keep in mind. For example, if you're first starting out with trying to manage the condition, an approach that a lot of people undertake is they follow an elimination diet. So this should always be done under the supervision of a health professional, but it means that you may cut out a lot of foods to bring the general level of reactions you're having down, and then it means that you can slowly introduce them so you're better able to understand which of them are giving you a reaction. And it's very useful, especially if you're a patient that's reacting a lot of the time and you're not exactly sure what it's to. So keeping in mind that these food groups have been researched and evidenced to have a slightly elevated risk is useful because it might mean that those are the kinds of food groups that you begin by cutting out in the first instance, and you can slowly bring them back in over time. Number 2 is slightly complicated, so I'm hoping that I can give you a very concise explanation. Essentially, you may find, and let me know if this is true for you in the comments below, because this is certainly the case for me, that when I consume different things, the kind of systemic reaction I get might vary. So for example, one of my allergens is dust and dust mite, and I usually get like sinus congestion or respiratory symptoms when I'm reacting to that. However, a lot of my more food-based triggers will cause me digestive distress. I'll get tachycardia or feel faint and dizzy and be at risk of anaphylaxis. And it's very interesting how they present differently. In terms of reactions in the body, we know that mast cells are responsible for causing them, but we don't understand in depth the chemistry of how that happens to a full extent. I actually have behind me, this is so sad, but this is a mast cell releasing histamine. And histamine is the most common chemical mediator that we know about and have researched extensively that causes reactions. However, given that we're now aware that there's multiple chemical mediators that may be involved, there are also treatments that specifically target those. So again, this is really something that needs to be done with the help of a medical professional, preferably an immunologist if you have access to that. But it will mean that you could tailor your treatment plan and particular medications to chemical mediators that might not just be histamine that are causing you trouble in your reactions. Number 3 is to try and find methods that best work with the way that you process, the way that you communicate and interact with information, the way that works for your access requirements, that mean you can begin to start getting an understanding of your reactions, what they might be, how often they affect you, and in what intensity. I mentioned some examples previously, like keeping a food diary, which works well for some people. Some people use apps to track things. If you have support around you, also enlisting the help of your friends and family can be useful. Honestly, it's such an overwhelming task to do this in the first instance. I remember when I first got diagnosed and I was beginning to manage and learn about my condition, I found it so challenging. I was reacting all of the time, and oftentimes I wouldn't know exactly what that was too. So having some help on board can be really useful. Another method that you could use is also continually rotating your foods if foods are what causes you reactions oftentimes, and this will mean that it can help you to start picking out what those common symptoms were and what they might match up with food-wise. But it's a very complicated process, so take your time with it, don't put too much pressure on yourself, try and experiment with different methods, and also understand that it's just hard. It's really, really hard, and it can feel like a lot of responsibility, which is why if you have people around you to help, that can be really useful. On that note, number 4 is be aware of fear mentality. I really wish that when I got first diagnosed or when I was reading resources about mast cell problems, the mental health side of things would have been more recognised. Living with the day-to-day risks of MCAS and also the debilitating symptoms can be extremely challenging. And in a world of triggers that could elicit a reaction, even to unknown substances, and could be as extreme as anaphylaxis, which is potentially life-threatening, it can come with so much anxiety, and that is absolutely valid. And it can be really easy to fall into the trap of wanting to avoid everything, anything you have even a minor reaction to. It creates fear because the symptoms are so uncomfortable and it can be really challenging. But it's important to try and have mechanisms to maintain rationality when it comes to dealing with your triggers. They should always be assessed based on risk, intensity of reaction, and the impact it has on your physical and mental well-being. So that might mean that going on an elimination diet, cutting out 5 different food groups, would actually be incredibly unhealthy for you, because at the same time as managing this condition, we need to have access to nutritional and energetic resources, and we also need to take care of our mental health, especially if you're somebody that struggled with disordered eating, or as a result of managing this condition, your relationship with food is not quite as healthy as you'd like it to be. So what can you do about this? Overall, be kind to yourself. It's an incredibly difficult journey, and it's valid to have severe anxiety around the issue. If it's something that you're struggling with, you should seek the help of a mental health professional. I know it can be really hard to find mental health services that equally understand the depths of chronic illness, but even anxiety and CBT, for example, can be really useful in helping you to manage the feelings you have around food or other allergens, and how that's also affecting your day-to-day life. And remember, it's also okay to have reactions. And this is something that I struggled with a lot. When I first got diagnosed, I wanted to cure my condition. I wanted to get to the point where I wasn't reacting at all. Obviously, more serious reactions, especially anaphylaxis, is a huge risk, and avoiding that is absolutely essential. But for example, if there are foods that you're eating and they're giving you a mild reaction, it might also be okay to keep consuming them. Again, this needs to be under the supervision of a health professional. This is an extremely complex condition. But, for example, when I started having low-dose immunotherapy, I started to desensitize from my allergens over time, but I felt an extreme amount of anxiety about then retrying foods that I had had a reaction to in the past, even though now my body might have been able to manage them much better. So it's a process of trying to overcome that mentality of when it is safe to do so, trying new foods, trying foods that may now be desensitized, or even keeping eating things or interacting with things that you may have had a mild reaction to, simply because the well-being of taking care of your overall life means that that is the best option for you. So number 5, and I think the message of this video overall, is don't buy into the fact that there is a roadmap to deal with this condition. There are certainly techniques, there is certainly information that can provide so much help and support, but it will be different for every patient. And the most useful thing is to enlist the help of specialists if you have access to them. And this will mean that you can not only manage the debilitating symptoms and the risks of your day-to-day life, but also other very complicated factors like maintaining a nutrient-dense diet that meets your energetic needs, and also maintaining a level of flexibility that means you're able to go about your day-to-day life in a healthy way that also supports your mental health. I know people with Mast Cell Activation Syndrome who have multiple specialists to help deal with their conditions, like having an immunologist, an allergist, a nutritionist, a dietitian, and mental health professionals. Of course, not everybody has access to specialists, and it's such a difficult issue to feel like you're on your own. But I hope that, for example, series like this one can really help to condense some of this information down in an easy to understand way, and I hope that what I've dealt with over the last 10 years can also provide some support, even just some solidarity in how challenging this condition can be to live with. You are certainly not alone. So, I know that I didn't exactly address this question, but I really hope that there was some useful information for you in this video. So thank you so much for watching. I'll be answering as many questions as I can in the comments below, so feel free to leave those there. Otherwise, have a lovely day, take care, and see you in my next one.